Hello, and thank you for taking the time to join us for a webinar. My name is Martina Janikova, and I'm the founder and CEO of Lara Health. And joining us is David Zetter, the industry expert and the president of the National Society of Certified Healthcare Business Consultants.
Hello, Martina. Thank you for having me.
We'll be talking about the most pressing issues independent medical practices are facing today, and novel care models like remote patient monitoring that can bring a new significant revenue source.
You know, independent practices are so important to our society to ensure that we have competitive healthcare systems. It is important for practices to consider all options in the delivery of and payment for services to ensure their success. Physicians and their practices that do not know these options and have expertise in them may want to consult with industry experts to assist them on practice improvement and ensuring ongoing success.
I'm sure we can all agree that the past decade brought some major changes that are directly affecting the profitability of independent medical practices.
No doubt, and there's growing pressure on doctors to deliver better quality of care at lower costs and better patient access and satisfaction, which is expected from both the patients and the payers. We see this across all specialties, and this trend is expected to continue.
Plus, independent providers are also facing new competition from chains like Walgreens and Walmart and direct-to-consumer services like Doctor on Demand. It is no surprise that independent practices have been slowly disappearing over the years. However, the last decade has also seen some big wins from new companies like Crossover Health and Livongo that found a way to deliver outstanding care to their patients while generating substantial profits. And I believe independent practices should take a notice because these companies have something in common: technology.
The pandemic really highlighted the need for independent practices to pivot with times and with technology. Doctors who were unable to see their patients virtually really took a hit revenue-wise, but even before the pandemic, the hours in a day are limited. So not using technology is really holding a lot of practices behind.
We see a lot of medical practices still work in the old-fashioned way. Face-to-face visits as their only revenue stream, doctors working long hours and not really leveraging technology to their benefits. David, why do you think that is?
Well, physicians and other providers are about as busy as they can be and seeing patients each day. Just trying to unlock the doors in the morning, doing everything they can to be finished at a reasonable time, and to lock the doors in the evening, ensuring that they hope to stay profitable. 13 years of medical education does not prepare a physician to run a business, let alone learn how to bill for their services, and their ability to have vision and develop a strategy to ensure their success. This is where you tap into industry experts. Their job is to improve your top and bottom line.
Well, this is what we are here to do today, to show you how new care models like remote patient monitoring can bring additional significant revenue stream to doctors and why you, as their consultants, should make your clients consider it. Remote patient monitoring became reimbursable in 2019, and for a typical primary care provider, it could add $500,000 a year in new revenue, with just 10% of existing patients enrolled into the program. And because remote patient monitoring can be overseen by the clinical staff, it actually doesn't require much time on the doctor side.
You know, it's worth mentioning that it's not just Medicare anymore that is reimbursing remote patient monitoring services. So practices should find plenty of patients who qualify. More and more payers are searching for better ways to lower healthcare costs and to involve the patient more in their care. So more and more of them are reimbursing for remote patient monitoring.
If you are not familiar with remote patient monitoring, it's rather simple how it works. Patients with conditions that require frequent monitoring, like high blood pressure or low oxygen levels, monitor their health at home, using devices that can share the readings with the clinical team automatically and in real time. The clinical team uses a portal to access the patient data.
The reality is most practices are already doing some of the work required for remote patient monitoring. They just don't realize it. Every time a clinical staff member discusses a patient's health with a colleague or a specialist, or when they complete a medication refill over the phone, or call a patient with lab results, all of these actions are reimbursable for a patient enrolled in RPM.
Absolutely. That's a very good reason for practices to consider RPM, to actually get paid for work they are already doing, but just not getting paid without the patient being enrolled in a remote patient monitoring program. The practices that benefit most from implementing remote patient monitoring are usually primary care providers and specialists who care for patients with health conditions that require ongoing monitoring and management, such as cardiologists, nephrologists, and many more. On average, we have seen the typical primary care provider having at least 20% of their patient population eligible, often much more than that.
Offering remote patient monitoring doesn't mean patients stop in-person office visits. Remote patient monitoring is a very effective complementary service, and patients enrolled in RPM can still receive in-person care as needed. RPM allows the patient to be more involved in the comfort of their own home and makes better use of a patient's time and more efficient use of the practice's resources.
And there are a lot of CPT codes to use when patient care is not delivered in person. But even using the 4 basic codes, the ones with the orange dot next to them, can make remote patient monitoring financially very attractive, as there are now dedicated reimbursements for providing a monitoring device to a patient, care time provided without the presence of that patient, and payments for patients simply measuring. Now, these may seem small amounts, but they add up very quickly, as these are recurring claims. You bill them month after month for as long as the patient is eligible. And when set up and done properly, a practice can see $2,000 per patient per year in new additional revenue. And most primary care providers will have hundreds of eligible patients.
RPM services alone most often will produce plenty of additional income and profits without much of an increase in overhead expenses. Most of the work will be completed by ancillary staff. You cannot afford not to consider implementing RPM in your practice. I always suggest performing a return on investment calculation prior to implementing anything new in your business, as this is a sure way to ensure your success when you have a roadmap on where you expect to end up.
How much a practice can make a year will really depend on how much care time the patient receives each month. For example, with 500 highly engaged patients, you can achieve $500,000 a year just by billing the 99454 CPT codes, which doesn't require any care time from your clinical staff at all. If patients were to receive also 20 minutes of non-face-to-face care every month, a practice would achieve $500,000 with fewer than 350 patients enrolled in remote patient monitoring.
You know, what I like about RPM is that it doesn't actually require much time from the physician. If you look at the bottom line, this is the number of hours the clinical staff would need to spend a month to achieve the above stated revenue. One full-time MA can run a program with 250 patients that will potentially bring in an additional $500,000 of top-line revenue.
And again, it's not just Medicare anymore that reimburses for remote patient monitoring. Many commercial payers are now covering remote patient monitoring as well. Remote patient monitoring is a very attractive care program, and we made it the cornerstone of Lara Health platform. I'm a veteran in the RPM industry. I understand just how busy smaller independent practices are, the lack of resources and capital that often prevents them from implementing something new. So we built Lara Health specifically to simplify remote patient monitoring. We actually automate the admin work that comes with novel care models like RPM, so our clients don't need to waste time on non-reimbursable tasks or hire extra staff to run it. Lara Health's portal is simple and easy to learn because we streamline everything from patient billing to data analysis and patient engagement. We also support complementary programs like chronic care management, so practices qualify for more reimbursements faster. For patients, we have a wide selection of monitoring devices that they are already familiar with, including those that work without a smartphone or a tablet. Let me give you an example of how Lara Health delivers on its promise. Here's an example of a client who switched to Lara Health from a different platform. Not only we made their work easier, we also made it more cost-efficient and profitable. I don't believe a medical practice today can survive let alone thrive without a good RPM program in place.
You know, it's good that physicians work in their practice because they are the revenue generators, but you have to spend some time working on your practice too. You should consider options to improve and ensure your practice success because healthcare is only going to become more competitive and patients are starting to make more decisions in who provides their care. Be the one they choose because you provide your patients more options and better care.
I hope we gave you a good basic understanding of remote patient monitoring. If your clients are medical practices that would like to learn about remote patient monitoring, we have an affiliate program that helps healthcare business consultants to gain a deeper understanding of various remote care models and share in their clients' successes. Please reach out to learn more, and thank you for your time.